to our third speaker this afternoon, and a local speaker from Russia, Dr. Marina Popova, and she will give a talk on invasive fungal diseases in adolescents and young adults after allogeneic hematopoietic stem cell transplant.
Глубоко уважаемые,
distinguished colleagues, distinguished organizing committee, distinguished chair, madam, and thank you for this opportunity to talk to you. We have done our work on the study of the epidemiology of invasive mycosis in adolescents and young adults after allogenic stem cell transplantation. Despite the fact that the methods of diagnosis and treatment have improved in hematological patients of invasive mycosis, this is still a challenge, particularly after allogenic transplantation of stem cells. The unique nature of our population is known better by pediatricians rather than adult physicians. They are, patients who can be referred to the group of adults or group of children. Different approaches are to be used, including the anti-cancer treatment. And talking of the data, so there are few data on invasive mycosis for this group. I would say that practically there are none. I have not found a single publication which would testify about the epidemiology for this group of patients. Of course, there are many studies which have been done, or anyway, several, which testify to the fact that invasive mycosis prior to allogenic transplantation of stem cells are not the problem after the transplantation, will not influence the results of the therapy, but that was done only for the adults. And that's why we have decided to do this for the adolescents. We wanted to study the epidemiology of the invasive mycosis from 15 to 25 for this age group. Our retrospective study had included 80 patients, and the first allogenic transplantation was done within 2 years from 2013-2014. The median follow-up was 20 months. And as for the criteria for the diagnosis of invasive mycosis, where the EORTC of 2010 and active invasive mycosis, that means that we have diagnosed it directly, immediately before allogenic transplantation. And as for the event after the transplantation, so that would include not only new mycosis, but also a recurrent mycosis, the one which was diagnosed prior to transplantation, the median age 20. So from 15 to 25, you remember the age range. Mostly they were ALL patients. 18% of these patients had resistant ALL, that is not in remission when we did allogenic transplantation. As for the primary antifungal prevention, they were given fluconazole, most of them. As for the secondary antifungal prevention, most patients were given voriconazole. Most frequently, that was allogenic unrelated transplantation using the conditioning regimen with lower toxicity, and in more than 70% from this group, the graft versus host disease prevention was done according to this algorithm. As for the mycosis for this group in the 2 years was 19%, and 60% of patients had either partial response or stabilization, and they had this mycosis diagnosed immediately before the conditioning regimen was started. Most frequently, the diagnosis of invasive aspergillosis was the case prior to transplantation in patients. That was 2 months. Cumulative incidence of such events, invasive fungal disease events, within 1 year was 15%. Within 2 years, 18.8%. And most frequently, invasive aspergillosis was diagnosed. Less frequently, candida, and 1 patient had pneumocyst pneumonia. And I'd like to mention that the recurrence of invasive mycosis post-transplantation, which was diagnosed before, happened in just 1 patient. We have identified risk factors
that influence invasive mycosis following allogeneic transplantation during 2 years, age under 18, and benign lesion, active disease at the time of transplantation, neutropenia grade 4, granulocytosis for more than 20 days, and acute GVHD of grade 3 and 4 when corticosteroids were given. The efficacy of therapy was evaluated by means of overall 12-week survival from diagnosis of invasive mycosis in post-transplantation period. 93% of patients remained alive for 3 months since the diagnosis was made following transplantation. Unique data were obtained, and we are very proud of them. The development of invasive mycosis prior to transplantation has no impact on the results of therapy and does not reduce the efficacy of transplantation. Here, we have a subgroup after the transplantation without mycosis before transplantation. No statistical differences were found. The rate of probable and proven invasive mycosis prior allogeneic transplantation was 19% in this age group from 15 to 25, and many patients had signs of the disease of invasive mycosis at the time of transplantation. The cumulative rate of events 15 and 19% in 1 and 2 years, and most frequently invasive aspergillosis was diagnosed. Risk factors, I'm not going to repeat them, but still we are very happy that overall survival and efficacy of therapy are very good, and invasive mycosis prior to and after the transplantation does not diminish the results of allogeneic transplantation. I would like to extend my thanks to all those who work in our clinic and care for our children, which is a challenging category. And of course, I would like to thank the lab workers and the institute named after Kashkin of clinical mycology.
Questions before we proceed to the next speaker? I'm sure the audience are all tired, looking forward for the evening. Thank you very much.
Thank you.